You are watching the DocTalk show.
We've discussed a lot on the risk factors, and now we know who could get a stroke. But when we talk of stroke, how will someone present with stroke? We said it's sudden cutoff of blood to the brain. But Dr. Darius, how will someone who has stroke present? How will you know as a doctor that this person has stroke?
Okay, so to understand stroke, again, we have to understand what the brain does. It does so many functions, whether it is controlling movement, like the arms or legs. It controls your ability to talk, to understand what someone is saying, not even read a book. Your ability to sense, to perceive sensation. For example, to see or to feel or to touch, on top of so many other functions. So what a stroke does essentially is when the blood vessel gets blocked, that part of the brain which is affected, the cells starve and begin to die. And when they begin to die, you start to lose the function of the brain in that area. So if that area of the brain was responsible for controlling movement of the legs, you start feeling weakness, maybe in the arms or in the legs. If the part of the brain was responsible for understanding, for talking, and understand what people are saying, that person will have difficulty in talking, expressing speech, or they may say things that people don't understand. So that can also be another indication that a stroke is happening. Or it may be that the person has changes in their vision, they're not seeing. People complain, I feel dizzy, I'm not seeing very well. That is also another feature of stroke, because the part of the brain that controls vision may have been affected. The brain cells may be dying in that area.
The ones that control the eyes.
The ones that control, the ones that receive information from the eyes and help you to see. So those may be some of the indications
that someone has had a stroke.
Might have a stroke. In the worst case scenario, if it hits the part of the brain which controls the level of consciousness, for example, near the brain stem, it can affect the vital organs like the breathing centers or the heart, where the control centers for the heart are, and that will result in a person losing consciousness. They can't breathe on their own. So you see people who will require machine support to breathe. It's because the stroke has occurred in the vital area that was controlling breathing.
And we know that some also show up with nausea or vomiting, or just loss of sensation. They say, I can't feel something. So Dr. Diana, out there in the communities where I'm at home with my father, and how am I supposed to detect as a layman that a stroke is happening? Because what Dr. Darius has explained seems to be happening in hospital. But how at home am I supposed to tell that my person is getting a stroke?
You can even just begin with, someone will be smiling, and then all of a sudden you see the face is not symmetrical. You see it is crooked on one side. Some people will start reporting suddenly the loss of energy. They can hardly lift their limbs, the legs, the arms. Sometimes it affects both, the one side, the whole side. Some people will even just report immediately the loss of sensation. It's which gets worse over time. And if it affects the speech center, then the speech, all of a sudden someone starts failing to talk and just using the gestures, then you know that is a stroke. And the best time now, that time, is to make sure that you rush this patient to the hospital and they are able to do investigations and start treatment. Because if you intervene in the shortest time before the cells die, you can reverse that effect of stroke. What happens is that most of our patients come to the hospital after many hours, and because of that, even if you get to know the cause, you can only, if there is a blockage or maybe there is a clot, you can give medicine to disintegrate that clot. But even if you do that when you have lost time, then you cannot reverse that effect. So someone you find will get permanent disability. So the best really at home, you get these symptoms, you need to rush to the hospital.
Yeah, it's just because today we say Dr. Diana is here in her capacity as a physician. Otherwise, I would have asked a question about how in Uganda, how someone, yes, in Nakapiripirit will rush this person to hospital at 2 a.m. in the presence of an ambulance. We shall talk about that later. So
maybe in addition, before, just to add to Dr. Twini, what she was describing, the facial changes or the weakness in the arms or the speech problems, there's an abbreviation called FAST, F-A-S-T. It's a very simple abbreviation to help people recognize that someone is indeed having a stroke. Where the F stands for facial asymmetry. It means when you ask the person, smile, and you see the one side of the face is not symmetrical, the smile is not the
they're
proper
not smiling
smile.
on both sides, they're smiling
Yes,
on
one side of the face looks crooked. That is an indication of facial weakness. The A means the arms, the arm weakness. So when you ask them, raise the hand, and then you see one hand can't raise more than the other, it means that maybe a weakness in that one arm. The S indicates the speech problems. They're talking, but some words are not coming out very clearly. That means a slurred speech. So if you see any of those symptoms, facial changes, weakness in the arm, or speech
Slurred
problems,
speech.
we have to act fast. That is the T. It stands for time.
Thank you.
Take the patient very fast to the hospital for quick
Immediate
intervention. Yes.
Thank you very much. Dr. Diana, when this patient gets to hospital, on a normal day, you as a receiving physician, what will you do?
The most important aspect of care for a stroke person is actually the first 4 hours of admission. If you delay in that period, then you've lost the patient. First of all, depends on the level of even consciousness. Some people even come when they're unconscious. So you must really ensure that they're admitted in ICU where you have facility. You make sure that you establish airway and ensure that they are breathing properly, their circulation is okay. If they have high blood pressure at that time, immediately you intervene and bring down the blood pressure. Of course, in the stroke, we also don't want to bring very suddenly the blood pressure, because already the dynamics in the brain has changed and the whole body is in panic. So you would bring down the pressure to a level that is manageable, and also do investigation at that time to establish the cause, whether it is the bleed or whether it is a blockage. Now, if it is a bleed, then you need to establish, if it is high blood pressure, the most common cause of the bleed is the ruptured vessel because of high blood pressure. But we have other conditions. We have other conditions like if we have aneurysm, if the vessel in the brain, for example, secondary to syphilis, you'll get a vessel that balloons over time, it balloons, then that balloon, the thinning of the vessel eventually gives way, and you get the rupture. So you need to go.
And keeps getting
it
weak
gets thinner,
and
thinner until it ruptures, and that one in most cases, our people don't, because we don't do regular check. By the time they come, they've had a big bleed, and many times you lose such a patient. But for ischemic, then there are some, once you intervene in that shortest time and you unblock, because there are some specific drugs that once you administer to a patient, it is able to unblock, to break down the clot immediately, and then the blood flows. Once you establish the blood flow to the brain, then there is a high chance that you actually can save that person.
The brain cells.
So you need to act. Actually, the outcome of the stroke, it is how soon you get the intervention. I have seen people who come to the hospital maybe after 1 day, and then they expect you to reverse. In most cases, if it is a big blockage, you find that you cannot do anything. You try to unblock, but you find that the sequel, the effect, the after effect of the brain injury gives you a residual neurologic deficit or symptoms that will remain with you
for life. So we'll now take a break, and please remember to send us all your questions on our social media platforms, on WhatsApp and on Facebook and on Twitter, and we shall answer them as soon as we get them.
You are watching the DocTalk Show.